Hi, my name is Whitney,
My name's Katie.
and today we're going to be talking about issues pertaining to end-of-life care and the grieving process. So our learning objectives for today, we're going to be talking about what are some issues that may arise from the dying patient while going through the end stages of life. We're going to list the 5 stages of grief and some issues that pertain to each one. And then what are some issues that may arise from a caregiver or nurse when caring for the dying patient. With a dying patient, there are several issues: depression, dignity, need to control the situation, pain, and coping. One big issue that is involved in end-of-life care is the pain and coping. Not everyone that is dying experiences pain, but the individuals that do can be treated to relieve the discomfort. Medications are given by doctors to prevent the pain. Patient pain levels are assessed by the nurse to rate overall severity of any pain that may be described. When pain is occurring, the patient may become angry and short-tempered, along with irritability that makes it harder to communicate by talking, sharing thoughts, and even sharing feelings. Coping mechanisms for patients usually involve religion, humor, and acceptance, but all individuals are different in the way that one copes with a great loss. Problem-focused coping is a main form which will enhance the patient's life satisfactory while helping them get greater control over their illness. The nurse caregiver also faces some issues, and that involves inadequate training, insufficient compensation, personal discomfort with death, and palliative care that's being provided.
Issues that arise from the 5 stages of grief. Denial. Issues that pertain to denial. The severe amounts can put a strain on the body, can suddenly diminish faith in yourself and others and in the future. Too much isolation can cause a negative effect on your body's emotional and physiological state of mind, and medications prescribed by the doctor can have some harmful effects in this stage, like increased depression and anxiety. Anger. Issues that pertain to anger. The patient may feel embarrassed, ashamed, or shocked after the outburst. Family may distance themselves from the patient in this stage. The patient must realize and accept that anger is a normal part of grieving and move through it. The individual may project feelings onto others and question their religious beliefs. Bargaining. Issues that may pertain to bargaining. The patient is giving themselves false hope by making some type of negotiation. Example: please God, if you heal me, I promise to go to church every Wednesday and Sunday with my family. Patient feels guilty in this stage of grief. The individual starts to think of never-ending what-ifs. Example: what if I had went to see the doctor sooner? The flu symptoms wouldn't be this bad. Depression. Issues that pertain to depression. The patient may feel empty inside or be withdrawn from life. The current situation might be too much for the individual to handle all at once and may become overwhelming. The patient may not want to be around others, don't feel like talking, or feeling hopeless. Suicide is a risk which leads to some patients losing their sense of hope and are ready to end their life sooner than the physician expects. Acceptance. Issues that pertain to acceptance. Patients need to feel that it's okay to let go by expressing their feelings to others, but this is difficult for them to physically do. The reality of not coming back is hard to adjust to. Emotions will overpower the individual by appearing and reappearing.
In conclusion, while wrapping up all of our ideas about this topic, we learned that not every individual is the same when going through these end-of-life stages, and they deal with each period differently. Therefore, as nurses, we need to become aware and capable of meeting each patient's needs and become familiar with their choice of daily lifestyle. Some situations will be similar, but everyone deserves to be treated as an individual with the same rights, dignity as those who are not sick at all.
The end.